And for our closing talk for this meeting, and I do appreciate the great attendance we have today, I'll just put that out there now. We have Dr. Patricia Cronin, who's going to talk about a problem we do see, their breast issues in men. Dr. Cronin.
Okay, so good morning, and for the last talk, I'm going to run through some issues that we see clinically. I have no disclosures. So some of the topics I'm going to cover this morning are what kind of breast complaints do men come to clinic with, what kind of investigations or workup should we perform, what is our differential diagnosis and how our management would differ, and obviously we'll come to talk about male breast cancer, how we would approach it from a surgical point of view, adjuvant therapies and other considerations. So all men or boys are born with a certain amount of breast tissue, and it's only with puberty and estrogen that you get stimulation with breast tissue proliferation, and androgen antagonizes these effects. We sometimes see it in infancy as a physiological gynecomastia, and very commonly during male puberty when there's an increase in estrogen and testosterone, and you get a transient proliferation of the ducts and stroma. They get a small breast bud, which will subsequently involute with atrophy of the ducts. So in most men, their normal male breast usually contains subcutaneous fat, and there might be a small subareolar ductal tissue remnant. They don't get lobular development. You need estrogen and progesterone for that, and it's generally not observed in men. And as we'll see later, this has an influence on what subtypes of male breast cancer we see, with lobular carcinoma not really being seen in men at all. With respect to what male symptomatology we see, the most common probably in general practice is breast enlargement or gynecomastia. This can either be unilateral or bilateral. There can be associated breast pain or tenderness. Of course, you can get men presenting with a breast lump, and often breast enlargement and breast lumps can be confused and in their description by the patient. You can also get nipple discharge, and often a noticeable indication for a patient is they notice some nipple changes with retraction. So what kind of differential diagnosis? As I say, male breast cancer is rare, but can occur and needs to be considered in any man presenting with a new breast symptom. But most commonly are gynecomastia, pseudogynecomastia. They can also get fat necrosis.